I'd like to state at the outset of my remarks, while we respect the motion put forward by the members opposite, it fails to recognize that our government is already taking action to increase supports for mental health and addiction services across the province, including in the north. Therefore, I cannot support this motion. There is a well-known idiom that says, "Before you judge a person, walk a mile in their shoes." This adage reminds us that we must understand before judging. It also reminds us to practice empathy. Mr. Speaker, I am the mother of 3 daughters. When our middle daughter, Monique, was born in 1987, a dark cloud descended almost immediately. She had jaundice and then colic, but was otherwise a healthy baby. But I soon became very unhealthy. I developed severe symptoms of postpartum depression, symptoms that presented in the hospital. Within weeks, it was necessary to seek help from extended family in caring for our infant daughter, while I sought medical assistance. I was fortunate to have a very good family physician, Dr. Hugh McKee in Saskatoon. He was ahead of his time with his knowledge in this area and was a godsend to me. Thankfully, we worked together in the journey back to health, and he made it clear that I had to do my share of the heavy lifting needed to regain my mental health. Fast forward 3 years. Our 3rd daughter, Janelle, was born in 1990. Dr. McKee and I put a strategy in place in the event that I might be struck again with postpartum depression. This time it took 3 months to arrive, but arrive it did, and with force. The road to recovery was a bit easier, as I now had the confidence that recovery fully was possible. I was fortunate to have a supportive and understanding husband to make that journey with me. Needless to say, Mr. Deputy Speaker, there was not going to be any attempt for a son after these 2 dreadful experiences with postpartum depression. Dr. McKee was chosen as the Saskatchewan Family Physician of the Year in 1992, in part, I believe, because of his knowledge and ability to help his patients suffering from mental illness. Dr. McKee passed away from pancreatic cancer just last September, and I was heartbroken. I had to attend his funeral. I wanted his wife and son to know just how much he had helped me over the years. Mr. Deputy Speaker, I share this personal story for a couple of reasons. First, that it might be a beacon of hope for any mother who is listening today and is dealing with postpartum depression. There is full recovery. Another reason is that I had to accept my own responsibility and do the work to get better. Lastly, I can relate to the people of this province who are suffering from mental illness, as I have walked many miles in those shoes. I am so encouraged, Mr. Deputy Speaker, that the maternal mental wellness program through Healthline 811 has been fully implemented by this government. I am also encouraged that family physicians are now trained to deal with depression and postpartum depression. My new family doctor told me this is a significant part of his practice, treating depression and anxiety with his patients. But we haven't stopped with this program, Mr. Deputy Speaker. Our government will also be implementing a targeted physician training program to improve the ability of physicians to assess and treat child and youth mental health conditions in Saskatchewan. There is $100,000 in the budget for this initiative. It will assist in reducing the wait times for child and youth psychiatry services. We recognize that there can be significant wait times to see psychiatrists, particularly child psychiatrists in Saskatoon, and this is just unacceptable. Training family physicians in mental health is one way to improve these wait times. General practitioners now account for a large amount of mental health support and assessment in our communities, but there are others: social workers, nurses working in service areas such as the Healthline, the Saskatchewan Cancer Agency, and primary health care clinics, and primary health care counsellors in a number of communities in the province. Mr. Deputy Speaker, I read an article written by a farmer and the co-founder of Women in Ag, Kim Keller, in the fall 2017 edition of Farmer's Voice. In 2014, Kim received a message from a friend that one of her neighbouring farmers had committed suicide. Then a colleague contacted her in 2017 that another farmer was lost to suicide. Kim took action. She moderated a panel on mental health just a few weeks later at an Agricultural Producers of Saskatchewan meeting, where a resolution was passed to adopt mental health in the ag industry as an issue to focus on. In Kim's words, quote, "Farm stress is real and suicide is real," end quote. I note that the Ministry of Agriculture supports the Farm Stress Line, providing farmers with resources to assist with farm stress-related issues. We are spending $330 million on mental health and addiction supports in the Ministry of Health 2018-19 budget, an increase of 52% since we formed government in 2007. Over 5% of the ministry's budget in this budget year, or $284 million, was allocated directly to mental health. There is a total of $367 million in this year's budget on mental health services, as these services are not just limited to the Ministry of Health. The Premier, the Deputy Premier, and the Minister of Health have committed to increasing the 5% for mental health services to 7%. On March 12th of this year, during question period, the Minister of Health responded to a question about committing funds to raise mental health and addictions funding to 7% of our overall health care budget, and I quote, "Mr. Speaker, the Deputy Premier and the Premier, both in the leadership race, said it was their intention to get to 7% of the budget. That is our goal. We are going to get there as soon as finances allow, Mr. Speaker," end quote. This Sask Party government has committed $4.2 million to hire approximately 40 full-time positions in the communities of Saskatoon, Regina, Prince Albert, North Battleford, Moose Jaw, Swift Current, Yorkton and Weyburn to develop community recovery teams who will provide support to individuals with complex and persistent mental illness. $400,000 is being invested to expand addiction services in Prince Albert and northern Saskatchewan and to provide specialist consultation services to physicians and other service professionals. The new Saskatchewan Hospital North Battleford is expected to open in the fall. It includes 188 long-term psychiatric rehabilitation beds and a 96-room secure unit for offenders living with mental health issues at a capital cost of $332 million. The Ministry of Central Services budget has committed $1 million to cover the additional costs of increasing beds for this secure unit. The Ministry of Health has provided the former Keewatin and Mamawitan health regions with additional funds of $325,000 to support community suicide prevention initiatives, including 93 staff who have been trained in mental health first aid. In our schools, there is over $30 million dedicated to mental health staff. This pays for 236 counselors, 70 psychologists, and 78 social workers. In Saskatoon, a new mental health assessment unit opened just last month at the Royal University Hospital, located in the Dubé Centre. 450 take-home naloxone kits have been distributed, and 1,200 individuals have received training on how to recognize and respond to overdoses. Suboxone has been added to the Saskatchewan formulary to treat opioid abuse. Matrexone and Caprosat has been added to treat alcoholism. It is encouraging that communities in the north are taking initiative themselves. For example, the Lac La Ronge Indian Band is partnering with the Red Cross to develop a community safety plan and introduce suicide prevention training to schools in the area. Mr. Deputy Speaker, this motion speaks to increasing supports for mental health and addictions across this province. Here are the facts since this party formed government in 2007. Total funding for mental health and addictions has seen an increase of 52%. Mental health funding has increased by 69%, while addictions funding has increased by nearly 49%. This increase in investment supports 1,200 mental health positions and 300 addictions full-time positions. There has been an increase of licensed psychiatrists at 29%. There has been an increase of psychologists by 27%, an increase in clinical social workers by 48%. And this government has reached a bilateral agreement with the federal government whereby Saskatchewan will receive $158.5 million in targeted funding for mental health services over the next 10 years. Mr. Deputy Speaker, there is more work to do. We recognize this, but to suggest that this government has not increased supports for mental health and addictions in Saskatchewan is incorrect. While the motion raises an important issue, I cannot